Welcome to this edition of the First Aid Show. In this edition we're going to look at some common injuries and how they can be treated. There are several more types of injuries that can occur. These include contusion, a bruise or a blunt blow. Different people bruise in different ways. For example, the elderly or young may bruise more easily. Applying a cold compress can help reduce pain and reduce blood flow, therefore reducing swelling. An abrasion, a scrape to the skin. This is a minor injury and you may well just need to rinse the area with clean water or saline solution. It's usually only a small capillary cuts and skin removed, so there may not be need to cover it as it should stop bleeding quickly. Laceration, a rough tear to the skin such as catching your hand on barbed wire. These can be serious and they are treated the same as for serious bleeding. An incision, a clean cut, such as cutting yourself on a knife. These can be serious and in some cases life-threatening, as it will depend on what damage has been done to the body. You treat these the same as for serious bleeding. A puncture. This is where an object goes straight into the skin, such as a stab wound. Again, this can be serious as you don't know what damage has been done. Treat as for serious bleeding, and if the item is still in the body, leave it and bandage around it. A velocity. This is where an object goes through the body, such as a gunshot, usually resulting in an entry wound and an exit wound. The exit wound may not be exactly on the other side of the body, as it may have been deflected inside the body. This is serious and treated as for serious bleeding. You don't know what damage has been done as the item went through the body, so you need to get help very quickly. Amputation. When a body part has been removed, such as a finger, wrist or a leg. Sometimes there are only partial amputations. Keep the patient calm and treat for shock and treat for serious bleeding. Tell the EMS what has happened and wrap the severed part in cling film or a plastic bag. Wrap it then in gauze or soft fabric and place it in a container of ice. Do not let the ice touch the severed part directly. Mark the container with the time of the accident and give it to the EMS team. And finally, degloving. This is when all the skin has been removed from a body part, such as when a ring gets caught in a machine and gets pulled down to remove all the skin from the finger. This can be very serious and distressing for the patient and the first aider.